Bonjour Monsieur le Président.
Monsieur le professeur.
Je suis ravi, merci au nom de CHAM de nous recevoir. J'ai plusieurs questions à vous poser. Mais la première, c'est, si j'ai souvenir, vous étiez dans une vie antérieure vétérinaire. Et vous étiez au Haras du Pin, et vous avez participé aux soins des chevaux qui ont gagné avec l'équipe de France la médaille d'or à Montréal, aux Jeux Olympiques de Montréal en 1976. Est-ce vrai?
C'est vrai, j'étais le vétérinaire de l'équipe de France
Yes,
aux
I
Jeux
was the
Olympiques de
veterinarian
Montréal.
for the French
Je
team
dois dire
during
que
the
vétérinaire,
Montreal
je l'étais,
Olympic
mais on
Games.
le reste toujours.
But, you know,
Dans une
once a
forme
vet,
d'esprit,
always a vet,
dans une
in
forme
a way,
d'approche.
in your
Comme quand
mindset,
je pense
in the
que
approach
médecin, on l'est toujours.
you have to certain
Même
things.
quand on a
Once a
quitté
doctor, always a
l'exercice
doctor,
direct.
even when you
Et
stop being a
au
physician.
fond, pour moi,
For
c'est
me,
votre thème.
I
Il y a
mean, this
vraiment,
is the subject
je vais
today,
dire en français, une seule santé.
but there is
Et je crois que
only
c'est
one health, une seule
tout à fait
santé in
essentiel.
French. And
C'est
that
une
is
notion de bon
absolutely
sens.
essential. It's a
On
matter of common
analyse tous les
sense.
facteurs d'émergence
We
des maladies
analyze
et on
all the
associe
factors
la santé
accompanying
humaine,
the
la
emergence of new
santé
diseases,
animale
and we
et l'environnement.
combine human
J'y
health,
reviendrai
animal health,
dans un
and
instant.
environmental health.
Et
I'll come back
la
to
crise
that in a
actuelle nous
minute.
montre cette
Now, the current
interaction
crisis is showing us that there is an
entre
interaction
environnement,
indeed between
réchauffement
environment,
climatique,
global warming,
apparition de nouveaux
and
virus.
the appearance of new
Mais
viruses.
je vous le dis très
But
sincèrement,
I'll be very honest.
ça ne peut pas rester
It
qu'un
cannot be
concept ou
construed
un
as
slogan.
only a concept or
Ça
a
ne peut pas
slogan.
exprimer une forme de
It
condescendance.
should not
Je me rapporte
be
à l'édito
construed
du
as a form
président
of
du Conseil de
patronizing,
l'ordre
and
des
I would like to come
vétérinaires.
back to the editorial
Ça ne
written
peut pas
by
être
the
une condescendance
chairman
à
of the
l'égard de
veterinarian
la
board.
santé animale et
It cannot
à
be
ceux qui en
construed as
assurent,
a
j'allais
patronizing
dire, le
attitude
suivi.
towards animal health
J'ai
and those
parfois entendu.
in charge of
J'ai des souvenirs, vous
preserving
savez,
animal health.
au moment
I've
où
heard
on a
that.
débattu
You know, I have the
de la
memories
compétence
at
des
the time when we
laboratoires
discussed
vétérinaires.
whether veterinary and pharma companies were competent,
elle
whether
doit nous
the
permettre,
veterinary
me semble,
laboratories were
et
competent
c'est
or not
l'occasion,
for the
et c'est le
crisis,
sens
for the
de ce qui
pandemic.
va vous réunir pendant 2 jours,
But that's the whole point that
de
has brought
dépasser
you
les
together for the next 2 days.
stériles
We have
et
to go
d'aller
beyond
vers
the
une gestion
sterile
globale
silos.
qui
We
intègre
have to go
la santé humaine,
towards
la
a
santé
global
animale
management,
et la santé,
bringing together
les mots
human
santé,
health, animal
environnement.
health, and
Je crois que
environmental
ces
health.
principes-là, et c'est
I believe
l'occasion,
that
en fait,
those are
de
the
sortir
principles. I
avec
think
nos
it's an
cloisons,
occasion
de
for
nos
us to
clivages.
break down our
Je crois que
walls,
c'est
break
une
down
des
the
raisons pour moi
silos
avoir,
and the
et je dois vous dire
divisions,
que là, je
the
reprends ma
fractures, the
casquette de
divides.
président du
And
Sénat.
I would like here to
Sénat, c'est
speak
aussi
as
le
the president
territoire.
of the Senate.
C'est
The
sur le
Senate is
territoire
about
les
the
hommes qui ont des
territory,
problèmes
the
de
French
santé,
territory, and on the
santé
French
humaine,
territory we have
santé
people with
animale, la
health
production
issues, human health
agricole,
issues, human health
et santé
issues,
environnementale,
animal health
la
issues,
faune,
farm
la
production,
flore sauvage,
and
ce
also
sont
the
des sujets
environmental
majeurs sur
health,
le
the wild
territoire,
fauna
qu'ils
and the
soient
wild
d'ailleurs
flora
rural ou urbain.
are major
Tout à fait.
issues
Alors,
on the
le Sénat,
territory, be it rural or
est-il
urban.
équipé pour cela?
Absolutely. Is the
Écoutez,
Senate
La première, c'est
well
peut-être
equipped
les
to
leçons
deal
qu'on
with
peut
those
tirer
issues?
de la crise actuelle,
Well,
si
maybe
vous
we
me
can
le
draw
permettez,
lessons from the
et
current
peut-être
crisis.
revenir à
If
ce
you'll
que
allow
le
me,
Sénat
I'd like to come
fait
back to what the
actuellement
Senate is
dans ses
currently
commissions
doing.
d'enquête et
We
dans la
have
mission
investigation
d'évaluation
committees and
qui
we
continue,
have
qui
assessment
actuellement est très
committees. They
penchée sur la
continue
question
doing
de
their work.
l'outre-mer,
And
bien
they are very
évidemment,
much looking
mais qui,
into the issue
derrière
of the
cela,
overseas
elle est
territories.
présidée par Bernard Jomier.
And
D'ailleurs, un
the
médecin,
committee
vous
is
voyez.
chaired
Le
by Bernard
rapporteur
Jomier,
n'a
who's
rien
a
d'un
physician
médecin,
himself.
c'est un
You see,
agrégé
the
d'histoire,
rapporteur is not a
Roger
doctor, he's
et
a history
l'autre
professor,
rapporteur est
and
issu
the
du
other
monde
rapporteur
rural,
comes from
et
the
il est un élu des
rural
Hautes-Alpes,
world.
Jean-Michel
He is
Arnaud.
a
Mais je
senator
crois que
from the
ce que-
Alpes
si vous me
region,
permettez,
Jean-Michel
qu'est-ce que
Arnaud.
je
But
tire Qu'est-ce
what
que nous
lesson
tirons
can we
au
draw
Sénat?
from the
La première
crisis in
constatation
the Senate?
sur les leçons de la crise actuelle,
The first thing I have observed
c'est que
regarding the
nous
current
avions
crisis is that
en
we,
2020, les
in
premières alertes
2020,
qu'on avait
we
eues
forgot. We
au
forgot
début des années 2000.
that
SRAS,
we had some
H1N1,
alarms in the years 2000.
Ebola. Et au
SARS,
fond,
H1N1,
on n'était pas prêt.
MERS,
On avait un niveau de préparation
COVID,
insuffisant.
and Ebola,
Je me
but
rappelle
we
d'un-
weren't ready.
d'un rapport d'un
We were
sénateur,
not
d'ailleurs,
prepared. I
professeur de
remember a
médecine,
report written
l'assistance
by a
publique
senator
au
who
hôpital
was
Marseille,
actually
professeur Giraud,
a professor of
nous avait
medicine
mis en
in the
garde sur la
Marseille's teaching
préparation
hospital, Professor
par
Giraud.
rapport
He
à
warned
cela.
us. He
La
warned
deuxième
us about
constatation que j'ai faite,
getting ready
c'est
to
que la
face
crise
such
a
a
mis en
crisis.
évidence à la
So
fois
what I observe is that
et
the
là,
crisis has
une centralisation
shed the light on the fact
excessive
that we have reached an excessive
et
level of
paradoxalement,
centralization in
une
France.
gouvernance
And
très
paradoxically,
éclatée.
our
Je ne vais
governance
pas revenir
is
sur le nombre d'organismes,
too
sur la
widespread,
diversité
too scattered.
d'expressions,
I'm not going to tell
mais
you about
je
the
me
number
permets
of
de
bodies in
le
charge
dire,
of
au
governance,
fond,
but
on n'a
what
pas
I'm
eu de
really trying to
vision
convey here is that
stratégique.
we did not
Et on a eu
adopt
des
a
consignes
strategic
centralisées
vision,
souvent
and we
inadaptées
received
aux
centralized
réalités des
instructions
territoires.
which were
Ça, il faut
not
vraiment
in fitting with the reality of the territories. We will see this when we introduce proposals for reforms. There is the 4D law that should be examined by the Parliament in December. But that's what the Senate Investigation Committee said. The investigation committee was made up of physicians. Well, the chairman was Alain Milot, a physician, not just vets, there were physicians as well. And he said, there seems to be a paradox here, too much centralization, and at the same time, governance is scattered. So you see, there are too many bodies and institutions, forgive me, but we have to face the fact that we need to review all of this. And maybe this is something that you're going to discuss. You probably have discussed it already during the day. The role played by WHO. WHO plays an essential role. So we really need to look beyond our national borders. And yet, we also have to strengthen the regulation mechanisms within the EU. And France is going to be the president very soon, and we should start thinking about that because, I mean, there is no shedding our national responsibility regarding health. We simply need to share responsibility, and I'm going to make a comparison with animal health. Remember African swine fever? We manage collectively, jointly, the way the epidemic progressed. And we really have to collaborate in an operational way. And we even thought about creating a national sanitary safety agency in Europe. Let's be positive. More than 65% of the population in the EU has been vaccinated. I mean, I consider that as a success. Of course, there were issues, supply, market, but, you know, like is always the case in a democracy, everybody is ready to criticize. But yes, we had trouble getting started, but then the strategy actually delivered in Europe and we reached satisfactory results. So that's how I see the crisis. Those are the observations I have made, the national dimension, the European dimension, and perspectives. But here, the reaction must be political on the European level, on the national level, and on the global level. There are three levels. So, Professor, you were talking about reforms a minute ago. Yes, of course, because you've just made observations. It's all very well, but what do we do now? And what does the Senate do, if anyone is going to do anything? Well, we have just discussed a law which we call 4D, decentralization, deconcentration, differentiation. And the fourth D is not quite so clear, decomplexification, if we may coin such a word. And the Conseil d'État says it's meaningless. But the crisis has shown the limit of the vertical organization. Initiatives taken on the field are important. And I'm not pitching the field against national decisions. You remember the crisis with face masks or the way vaccination centers were organized? I remember you made an iconoclastic proposal at the time, Professor. I know you. And knowing you as I know you, and we're friends, I think you were right to ask us to shoulder our responsibilities, and you talked about 2 weekends to protect vaccination. You know that I am one of those who said a long time ago, vaccination should be compulsory if necessary. Maybe this comes back from my veterinarian background, but yes, I admit I said that. The pair made by the prefect and the mayor, or the regional council or the departmental council, the French administrative distribution. This is important. And I believe that we are making proposals. We have voted for those proposals regarding the national healthcare regional agencies and the way they are organized. I used to be the chairman of the French Hospital Federation, and I was one of those who thought that we had to divide the country and the administration of hospitals in regions. But I know that these regional agencies were criticized, but also depending on the paradoxical instructions given by the central administration, they have been extensively criticized, sometimes rightly so. But when I look at the agency in Île-de-France area, 12 million inhabitants, I think they've done a good job. They've done the best job they could do in the situation. But again, let us draw consequences and lessons. What about a reform? Just a minute. Germany, Italy, those are federal countries, and they had to bang on the table. Angela Merkel said, stop, that's enough. We should do the business. How do we share the roles? Oh, yes, I remember that. The president of the German Senate, the Bundesrat, was with me when Angela Merkel banged her fist on the table. Well, we're not a federal country ourselves. But the fact that we are very close to our territories leads us to a democratic debate. There has been a democratic debate between each of our lenders. And even in Germany, they had a lender debate between the lands and the federal government. But this did not happen in France. And so the elected members of parliament and senators were considered as supplementary. And I would like to talk about the reform proposals. Regional health care agencies. We need to acknowledge that there is a département level, the French département districts. So they have to be empowered on the departmental level. And I'm sorry, I've seen them work. And in my department, where I am the prefect in the Yvelines, it worked really well. Because there was a lot of trust between the healthcare professionals, the administrators, the trade unions, the social organizations, and the prefect being the boss, overseeing everything. So I would like to reinforce that level. And I suggest that the Regional Agency Supervision Committee be co-chaired by the prefect and the region, the chairman of the region administration. And I'm sorry, but in Germany, maybe there was a multiple democracy, but we are suffering from a deficit regarding democracy in the field of healthcare. So this is one of a list of 50 proposals, and this is leading us to a debate. Do we need to regionalize our healthcare system? Mark my words, the proposal we are making to have this co-chairmanship and co-management system, that is something we need to take with a pinch of salt. We have to tread carefully. The principle is fairness, equal rights. In a country with absolute regionalization, aren't we going to lead to asymmetric rights between the regions? Well, we need to maybe balance this. Fair enough, but the matter of regulation is regulating is very important. So maybe if we decide to give more regional powers and a significant part of the funds, close to 4 billion euros for recovery funds, well, we could have a political discussion, in conclusion for the 4D law. Well, we spend 3,100 euros per French inhabitant per year for healthcare. Maybe we could give 30–40% to the regions through the département, and that could mean also that the poorest regions receive money from the richest ones. Well, I think we must conduct an experiment in 3 or 4 regions which would volunteer, and that would be a good idea. And that's the reason why the word differentiation is one of the 4 Ds in the 4D law. And experimenting could be a good approach. If we were to regionalize part of the recovery funds, we would move forward. But I'm very open to experimenting. Now, something else, something essential, research.
On a été quand même assez malheureux de voir que nous étions incapables de sortir un vaccin en temps utile, alors que les Français sont partis aux États-Unis pour le faire.
In due time, whereas French researchers went to the US to work on vaccines. So how do you see research in France? Yes, I admit, we were frustrated. We were disappointed that we did not produce a vaccine. It's not a French vaccine. I mean, in Pasteur's country, yes, of course, it is Pasteur's country, it is Leclerc and Vallées' country, and it brings us back to One Health. Doctors, vets, and pharmacists together helped us move forward in the field of research at the end of the 19th century. But let me say a few words regarding the structural issues that are burdening our research system. And maybe I could refer to the recent report written by the Court of Auditors regarding public research, especially in the context of the fight against the pandemic. And I'm not talking about this specific research for a vaccine against COVID-19. I think that our initiatives and our funds are too scattered. Maybe our funds are not sufficient, but not only they are insufficient, but they are being sprinkled. So we don't have enough and we sprinkle the funds. Our priorities are not well defined. And maybe I'm stating the obvious. We have an issue, there is no connection between academic research and the industry. So our startup companies are not being encouraged and supported. And there will be a session on what about the industry of tomorrow, draw for me the healthcare industry of tomorrow. And I think that this means it has to undergo a change. So far, the way we approached the healthcare industry was only budget-based, fund-based. We did not have enough money at the end of the year. Well, we took something from the pharma industry. It was wrong. It was wrong. Of course, benefits and profits could be taxed, but we entirely forgot that this is not only a way to balance deficits. So at this stage, never mind. Well, wait. I'm very pleased to hear you say this because there was a system in which healthcare was considered as an expense, whereas it should be considered as an investment. Absolutely, it is an investment and a service rendered to the population. While we're talking together, just before your meeting, I am thinking of what is happening in our overseas territory, and I feel for the people in the overseas territory. And there has been a discussion in the Senate. I have talked on the phone to the senators in the overseas territories. And our information mission is about analyzing what is happening, trying to find answers, trying to find ways to educate those people. But I definitely believe that the mission will have to look into how to draw the pharma industry of tomorrow. And yes, our Social Affairs Committee, our Economic Affairs Committee will have to look into this. And even the Finance Committee should play a role. We cannot be the adjustment variable for the national budget. I wish you a very fruitful meeting, and I apologize for having participated remotely, but I have a very important duty I need to attend on the territorial level. But thank you very much for your participation. Thank you, Professor.